and thank you for joining us today. My name is Teresa Powerski, and I am with Civitas Senior Living. We have the pleasure of being in the company with Dr. Jonathan Richey, who is a dermatologist with Baylor Scott & White, Dermatology Specialist of McKinney. Thank you for joining us today.
Thank you for having me.
July is UV Safety Month, so in the spirit of wellness and talking about community education, I thought of you and wanted to connect.
Thanks. So I'm glad you invited me and asked me to participate.
Thank you for taking the time, and I know we have some questions that we wanted to get into, but first of all, I just wanted to go into a little bit more about your background and what kind of drove your interest into dermatology.
Sure. When I was growing up, I grew up in California, and I had the opportunity to see the dermatologist a number of times to deal with some acne issues that I had.
Okay.
I went off to college and decided to become a physician, and then once I got into medical school, I was really driven towards dermatology for a number of reasons. I love meeting family.
Yeah.
So in dermatology, I get to see little babies and their rashes all the way up to grandma and grandpa and their skin cancers.
Okay.
And then all the acne and cosmetic things in between.
Sure.
So which is a lot of fun.
Okay.
So then pursued the field of dermatology, and I've been here in practice in Texas for about 10 years now, and it's been just a blessing for our family.
Oh, great. Great.
Yeah. Another thing I love about dermatology is dermatology has a big impact on people's self-esteem. And their self-esteem, their perceptions of their self is really important. And when I have a teenager that comes in with acne, and knowing that they can get better and feel better about themselves is such a wonderful thing for me to participate in. For those individuals that come in and they have wrinkles and they're worried about their sun damage, having options for them is just brings so much joy to me. And then for those patients that have cancer, that are struggling with wounds that aren't healing, being able to help those individuals. I get up every morning just so glad and excited I get to go to work.
Right. That's a great point, to really look at that whole spectrum. That's a really great perspective.
Yeah.
So here at your practice, is there anything in particular that's new and cutting edge that you guys are focusing on, or anything new coming down the pipeline?
Sure. Dermatology has such a wide range of options for treatment. We take care of hair, skin, and nails. And so today I actually did some treatment where we took out a patient's blood, spun out all the red blood cells, took the growth factors and the platelets and re-injected it into the scalp to help to stimulate hair growth.
Oh, okay.
Super awesome.
Nice.
We also use it for skin rejuvenation, doing that same type of a method.
Okay.
Dermatology is also very famous for our laser use. We use lasers to help treat red spots, brown spots, wrinkles. We have resurfacing options. And some of the really neat thing that's coming out in the past, a lot of people who had stubborn areas of fat, we have injections that we can use under the neck that will help to take away fat without having to do surgery or liposuction. We also have some lasers that are coming out with stubborn belly fat that you can't do enough sit-ups to get rid of.
Sure, yeah,
Non-invasive methods without having to undergo the knife. It's fantastic. Some really neat lasers and options for that.
Oh, that's great.
Yeah.
That's great.
Yeah.
Gotta love the new technologies that are coming down the pipeline. So that's great to hear.
Yes, it's really great. It's a lot of fun.
Wonderful.
And then we do all the other things that we do that you're familiar with dermatology, microdermabrasion. We do scar revision for patients that have had scars from acne or from surgical scars. We do chemical peels. We do surgeries for cancers and all those things as well. And because we're experts in the skin, we have the ability and the capability to make sure that when we do our surgical excisions, to use our quote-unquote plastic surgery techniques to make sure that you have the minimal scar as possible.
Good.
So it's a lot of fun.
Yeah, that's great to hear. So with July being UV Safety Month, so it's really important that we want to help to spread awareness for keeping our skin and our eyes safe. So with that being said, can we talk a little bit about the different types of UV rays that that can be harmful, and a little bit of education surrounding those different types of rays?
Absolutely. So an easy way to remember the differences between UV rays, UVA causes a lot of aging, so the A in the aging. UVB is more of the ray that's implicated in our burning. Both of them can cause cancer. So it's important for us when we're looking at our sunscreens to have UVA and UVB protection. UVC is pretty much blocked out by the atmosphere, so it doesn't come through as much. We get UV rays from a lot of different sources, mainly the sun, but also some of our lights. Some of the light spectrum can come from lights, and they've also seen some studies showing that maybe some of our computers and some of our incandescent lighting and fluorescent lighting can emit some rays that can be damaging as well.
Oh, interesting.
So because we get exposed to UV rays in so many different ways, it's really important for us to do our protective and our preventative measures, and that's wearing some type of a sunscreen, particularly in our face, because that's an area that's exposed a lot. So we encourage every patient to wear a sunscreen. The American Academy of Dermatology and the Skin Cancer Foundation recommends a 30 SPF or higher.
Okay.
In the studies, when they look at patients who are putting on their sunscreen, we don't typically put on the amount that the researchers put on to get that true SPF, let's say 30. They're showing that patients get about a half of what's recommended.
Okay.
So if you have an SPF 30 and you're putting it on your face, as the general population would do, they're getting about an SPF 15.
Oh, okay.
So it's no one's really putting on a quarter size amount of the sunscreen and on their entire face. And so it's important to put on as high of an SPF as you're willing to put on.
Oh, okay.
That's what I always tell patients. Whatever the highest one that you're willing to put on is good. They've done some studies showing that patients who actually they took a ski resort and they divided half of their ski resort participants and the other half, and they had one group put on 100 SPF and one group put on a 50 SPF, and they compared at the end of the day which individuals had the most sun damage and sunburns and irritation to the skin, and those that had the 50 SPF had more than the 100 SPF. So it showed that there were some differences, and so not a lot of people are willing to put on 100 SPF.
Okay.
And we can go into a conversation about why that is.
Yeah.
But the higher that you're willing to put on, that's the best one. A lot of people ask, Dr. Richey, which brand do you like?
Sure, yeah.
And I always say, I'm not a brands guy, I'm an ingredient guy. And I always tell the teenagers too, whichever one you're willing to put on, that's the one I want you to put on.
Sure.
So, because we know that the science shows that sunscreen protection slows down the aging process and protects us from cancer.
Sure.
It's been proven time and time again. So
Okay.
that's an important aspect. Now, sunscreen, even just in the name, it's a screen. It's not 100% blocking.
Right.
So seeking shade, trying to avoid the hottest and the sunniest times of the day are also important. In addition to, if you're really going to be out there, putting on a hat, wearing a hat, be the cool person out at the soccer field or the baseball game, and wearing the wide brim hat like your dermatologist would do.
Right.
I always tell the young kids as well, I say, there's this conversation that you're going to have later on in life. Many of us who are watching this today are in that category. And we wish we could have gone back and said, dear 18-year-old me, I wish I would have been better at my sunscreen.
Right.
So, yes. And a lot of people say, well, I get most of my sun damage before I turn 18, so why do it now in my later years? Still, the studies show that even sun protection now can be beneficial. There was a really neat study where they took 100 men and they said, okay, 50 of you, we want you to wear a sunscreen every day. And the other group, just do your normal activities. At the beginning of the study, they measured how many pre-cancer spots they had on their face.
Okay.
So at the end of the study, they had the group that wore the sunscreen 100% of the time, every day, and the group that didn't. And they compared how many pre-cancers they had at the end of the study. And just changing whether or not you wore sunscreen or not, 13% of your pre-cancers in the group that wore sunscreen went away.
Oh.
Compared to the other group where they just kept growing.
Right.
And so they're thinking that because you're protecting your own immune system by not getting that UV damage, your immune system is able to take care of at least up to 13% of those precancers. So
That's interesting.
that's a great study. So I always share that one with my patients, encouraging them to really be protected even later on in your life.
Right. Right.
So,
I guess that goes back into like a whole healthy lifestyle, right? So kind of your whole diet and your lifestyle choices kind of to help healing your body
That's
from
right.
inside out. Interesting.
That's right.
Great.
One of the things that patients will tell me, though, when I have this conversation with them is they say, well, Dr. Richey, I'm low in vitamin D. And we know that low vitamin D levels can cause problems later on in life with cancers. Low vitamin D can cause osteoporosis, hip fractures, those dangerous things in our life. So one of the things I encourage my patients to do is let's check and see if you truly are vitamin D deficient. If you're not, great.
Right.
don't need to go out and expose yourself to sun to get damage. If you are deficient, let's try and replace that vitamin D through other methods, through your diet, which is a huge source of our vitamin D. And then 5 to 10 minutes of sun exposure without sunscreen, your body will only make as much vitamin D as it can through that photosynthesis method, and the rest of it your body's just going to pee out. So don't go out more than 5 or 10 minutes without sun exposure or without sun protection, because you're just going to be being out all that extra vitamin D. So it's not a good reason to get more sun exposure to increase your vitamin D. There are other methods. So, yeah.
Good.
So one of the other things that we can do for our UV protection to slow down the aging process as well as to prevent cancer is using a lot of, well, let me start with, a lot of people may have some sensitivities to sunscreen.
Okay.
There are lots of different types of sunscreen out there. Some of the sunscreens will reflect the light or the UV ray off of your skin, and some of it will absorb the UV ray and undergo a chemical change in the skin. We don't see a lot of the sunscreens that absorb the UV ray and undergo a chemical change in the skin in kids' sunscreens, because that can cause a little more irritation to sensitive skin. So you'll see a lot of the kids' sunscreens that have the sunscreen that reflect the light off of the skin. Well, if light is reflecting off of the skin, people are going to see it. Right? So your zinc oxides and your titanium dioxides. So a lot of people don't like those sunscreens because it looks like you're going to the beach. Well, they have some new options that are zinc and titanium, which reflect the light off, but they have a universal tint in them. So it doesn't look like you're wearing sunscreen. So those are two different things to look at when you're looking at your sunscreen. Is finding one that you're willing to wear, and depending upon your sensitivity, perhaps look for ingredients like zinc and titanium as your main ingredients to avoid that sensitivity. But then that goes back to the other thing. For those that cannot really wear sunscreen or have too much of a sensitivity, hats are important. But then they have UV protective clothing now. For my daughters and for the young kids who don't really like sunscreen, they have these great rash guards. And the rash guards have a really tight weave, and you don't have to worry about lathering the sunscreen back on or reapplying the sunscreen. Or if you're out gardening in the garden or you're out on a walk in the mornings, wearing a shirt that has the UV protective weave in it, they call it UPF protection rather than the SPF protection. And that's usually 50 or higher. Those are great things to wear. And then they have the hats that are protective as well. So if you don't want to put on sunscreen, there are other ways to protect yourself.
So when we're looking at the difference between a waterproof sunscreen or water-resistant sunscreen and a regular sunscreen, how often are we looking at the need to reapply that within kind of a different time frame?
That's a great question. So the FDA came out with some restrictions on labeling for sunscreens. So they have, now you cannot use the word waterproof anymore. It's against the rules because there's no such thing as a true waterproof sunscreen. They have water resistance, and then they have a time limit. So they have a 40-minute water-resistant sunscreen, and then they have an 80-minute water-resistant sunscreen. And the way they did the studies is they took some individuals, they put the sunscreen on, they let them sit in the water and not move. And after 40 minutes, they brought them back out and they checked to see if the protection was still there. I don't know very many people who go out, who don't sweat, who don't play in the water for 40 minutes and do nothing. So you have to be careful. I always tell patients, if you're going to be out there swimming for more than 40 minutes or so, then you probably need to get out and reapply. Another place where the rash guards come in great use there. And then the 80 minutes, the same thing. After 80 minutes, if you still had that same protection that the sunscreen said that they provided at that 80-minute mark, then they would say, okay, we can label this at least 80 minutes of protection.
Much shorter time frame than you probably would think that would last for too. That's good to know.
So it's really important to apply your protection, the sun protection, at least 15 minutes before you go out. So don't go stand by the pool, put on your sunscreen, and jump in. You need to give yourself about 15 minutes at least for that stuff to get incorporated into the skin so that it's providing the protection you need. Or if you're going to be doing gardening, you may start to sweat, and we want to make sure it's incorporated well into your skin so you don't just sweat it all off.
Right.
So
Right.
some good ideas there.
Yeah, and that's a good point too. Probably areas that you don't think about, maybe like the back of the neck if you're bending over and you're gardening a lot.
Exactly.
So, yeah.
Yeah.
That's good too.
And we have a lot of patients that come in who have been gardening, come in with a lot of ant bites and everything. So protection with chemicals that have DEET in them, that can be protective. Usually 30 or lower. You don't have to go for the high ones, especially if you have sensitive skin. But those are good things in addition to your sun protection.
Yeah. Good.
Yeah.
Okay. Yeah, it's good to know.
Some of the other protective measures that my patients will do is, even though it may look funny to others, patients will drive with little gloves on their hands because that's an area that gets a lot of sun exposure.
Oh, okay.
So that's another protective measure that you can do. I keep a little sunscreen. My wife has some in her purse. I have some that I carry with me. And when I'm going on a long drive, put some on the back of my hands so I can avoid the sun damage there.
Oh, that's a good idea.
Those that do have a lot of driving, perhaps in their careers or visiting grandkids, that left side for those drivers, or if you're a passenger more often, that right side, if you can get some UV tint on your windows or wear some sunscreen really carefully on those sides, can be really helpful and protective as well.
Yeah, that's a good idea.
Recently, in one of the neighborhoods that I live in, they built a brand new school.
Okay.
And do you know what was the most fun thing that I saw that they built in that school?
What was that?
It was a shade protector, shade umbrella over the playground.
Yeah.
There are a lot of those that are coming out nowadays. So when you're looking for doing outdoor activities, try and do the morning and the evening, or try and find some of those places that have those shade protections.
That's a great point. And you're exactly right. Yeah, you do see those at water parks too a lot, where you see kind of almost the mushroom shaped sort of water park figurines out there. So you're right. That's a good point.
Yeah.
That's a good idea. What about about the advertisement that you're seeing now with like cosmetics with SPF in it?
Okay. There are a lot of our foundations and our bases that have some built-in SPF. As a general rule, most of them have in 15 SPF, or that's about as high as they get. Some of them will get a lot higher. And so if we go back to that previous conversation we had, if you're not really gooping on that foundation really heavy, you're probably getting less than a 15.
Right.
So I have two recommendations for patients when they ask that question. There are some sunscreens out there that don't have any moisturizer built in. They're just really purely sun protection. And so I'll have people apply that first and then apply their makeup on top of that. Some of them go well with makeups and some of them beat up when you're applying, so you have to find the one that works best with your makeup. But I usually recommend some additional protection.
Right.
Now there are some companies that are getting wise and they're adding some additional protection in there, so they're getting up in the 30s. So when you combine a bunch of chemicals together, then you run into problems where the chemicals start to become unstable.
Okay.
So a lot of times those makeups will have an expiration date on them because they are not going to last as long. So I think it's really important to watch those expiration dates on those makeups that have sunscreen in them so that you're not running into a problem where you thought that the makeup was providing your sunscreen and then you didn't get that protection.
Yeah, that's a good point. Yeah, I feel like you're seeing a lot more of the labeling and advertisement behind that coming out more.
Yep.
So.
Yeah. I think they've got some advertisements saying that pale is the new tan.
Oh, right.
Some of these other things that are out there.
Yeah, exactly right.
Yeah. Even some of my patients will come in with their spray tans, and some of them look good, some of them don't look good. A lot of times in some of my older patients who go and get those spray tans, they don't go on evenly because we have other blemishes on our skin that pick up some of the pigment and don't pick up the pigment, so it looks splotchy.
Right.
And those don't provide any sun protection.
Right.
Another thing that people do is they'll say, I'm going to go on a beach vacation coming up, so I'm going to go to the tanning bed and get a little base tan.
Right.
So the studies show in that regard that you're getting about a 3 SPF by doing that. The reason that only gives you a 3 SPF, a tan is a response to damage to your DNA. So when you have a cell and you've got the DNA in that cell, you expose that cell to UV rays, the DNA says, ooh, I don't like that, you're damaging me. I'm going to take all the pigment inside me and I'm going to put you up on the top. So when we look at our skin and we see that tan, that's the body's response to some type of damage already. So yes, you're getting a little more protection, but it's already a sign that you've got some damage that's happened and your body's responding to that by creating that tan.
Right.
So I don't recommend base tans.
Right. That's a good point. Very good point. I know we want to kind of talk about doing annual screenings and looking for that, but is it something common that you see patients come to you when they have severe burns from sunscreen or for getting into the sun?
Exposure.
Yeah.
I see patients on all wide spectrum. I see patients who've had lots of sun damage in the past. A common story I hear is they said, I lived in the era where we would go out with our baby oil and our iodine.
Right.
And the darker the better.
Right.
And now those patients are coming and seeing me and they're having precancers and cancers removed.
Right.
Which is unfortunate. So I always encourage them to tell their kids and their grandkids to be a little bit better at their protection.
Mm-hmm.
I also see patients that come in with sunburns, and they always say, Dr. Richey, I knew I was coming in to see you, and I figured I'd still come and see you even though I got a sunburn, and you'd yell at me, and I said, I'd never yell at you. You're already doing you already know. So I don't need to yell at you anymore. You already know that the damage has been done.
Right.
So I see that. And then I see a lot of patients who come in that are really wise and careful with their sun exposure. And they're looking for ways to prevent. So we have sunscreen conversations. But then a lot of my patients will come in saying, what do I look for to know if something is bad? And I will tell them a general rule that we've kind of helped community understand what's good or bad is the ABCD rules.
Okay.
Maybe we can talk about that for a minute.
Yeah, that'd be great.
Okay. ABCDs, the A stands for asymmetry. Okay. So if there's something on your skin that's not symmetric, when you cut it down the middle, and it's unequal on both sides, that should be something that should be seen by a dermatologist.
Okay.
Now, some of those things will come in and they'll be benign, but some of them won't be, and so it's good to have them checked.
Right.
The B part of our ABCD rule is the border. Anything that has a really good round, even border, it's well demarcated, is a good sign. Anything that has an irregular border or a jagged edge or something that seems to be growing or changing, that needs to be checked.
Okay.
So then our C is our color. So anything that has multiple colors in them needs to be checked.
Okay.
That could be a sign of melanoma. It can be a sign of basal cell carcinoma, squamous cell carcinoma, and a number of other ones. So our C is color, and then D is diameter. Okay. Melanomas always start small. Okay. So as a general rule, anything bigger than a pencil eraser really needs to be checked. But if you see something that's got some of those other criteria, the asymmetry or irregular border or multiple colors, and it's tiny, just let me check it.
Sure.
Melanoma is easily cured in the early stage. It can be life-threatening when it gets past the point of early and spreading to other parts of the body.
Right.
So, and now E, so A, B, C, D, E. E is evolution or evolving. Okay. So anything that's changing.
Right.
So I always tell patients, become familiar with your moles. Kind of like if you know your girlfriend's haircut when she gets a new haircut. You went to this house, you recognize it, right?
got to highlight it.
Yeah, exactly. So your moles, if it's got a highlight or it's got a new color, have it checked because then we can catch things early if it's something growing.
Good. That's a great acronym.
So, and then when you come in, we have another huge criteria in our brains that we go through when we look at the spots under our dermatoscope that will give us some more clues on whether or not it's benign or if it's malignant. Okay. So with the A, B, C, D, E's, those are the things that we look for a skin cancer called melanoma. The more commonly we see skin cancers called squamous cell and basal cell. Okay. Squamous cells, they tend to start as a precancerous spot that's more easily recognizable by being a rough, scaly spot that's tender to the touch. Okay. So if you have a spot that's rough, scaly, feels like maybe a little sandpapery on the skin, and it's rough to the touch, that could be a precancer. And those are easily treated with either a little chemical spray that we apply to the skin in the office, or some topical creams that can be applied to the skin. And that can prevent you from surgery and a scar. So that's really important. And then I always let my patients know that in between our visits, if they ever have something that doesn't seem to be healing, we always get little bumps and bites and everything, and their skin usually in 2 to 4 weeks should heal that up and take care of it. But if it's just not healing or it's bleeding, don't wait. Let's
Right.
get that checked because it could be a little skin cancer starting to grow.
Okay, good to know.
Another thing that we see for our patients that have had a lot of UV exposure throughout their lives, they'll start to have more fragility in their blood vessels.
Okay.
And so we'll see a lot of those patients that have had a lot of that damage come in with bruises on their arms.
Yeah.
First, we have to make sure that it's not something that's a problem with their platelets or their blood counts.
Mm-hmm.
And if that's all normal,
Mm-hmm.
and it's more because of the UV damage that they've had, there are some things that can help. A lot of times people say, oh, I hate these bruises on my arms. What can I do? There are some creams that are available, even over the counter. They don't need a prescription, that have vitamin K and arnica in them, which will help to get that blood that's stuck in the arms to reabsorb
Okay.
and disappear within just a week or two,
Mm-hmm.
rather than 3 to 4 weeks.
Oh, okay.
So that's something that's really helpful. So another good reason to protect that skin, so that in the future you don't develop those little spots
Right.
and those bruises that can happen.
Okay. Yeah, that's helpful. It's good to know.
Another thing that happens with a lot of UV exposure is the possibility of developing cataracts.
Okay.
Cataracts, one of the most common things, either is from UV exposure and also steroid use. So if
Okay.
you've had to have steroid injections for osteoarthritis or rheumatoid arthritis or other things, that can cause it as well. So that's another place to protect yourself, is wearing some UV protective eyewear when you're going outside as well.
Mhm.
So in addition to your hat and your sunscreen and your long sleeve shirts,
Right.
getting your sunglasses on. So they can either slow down that development of cataracts,
Mm-hmm.
and also to prevent melanoma, because that can develop within the retina inside the eye. So I always tell my patients, after we've had our good skin exam,
Mm-hmm.
to another preventative thing they need to do is have their eyes examined and have the retina looked at in the back,
Mm-hmm.
because we have a lot of pigment cells in the back of our eye,
Right.
which can develop melanoma. I had a really good friend in Michigan when I did my training,
Mm-hmm.
a young gentleman who had kids who developed melanoma in the eye.
Oh, wow.
Once you get a melanoma in the eye has to be removed,
Oh.
and then once it's very difficult to maintain that and contain it,
Right.
and it did spread to the rest of his body. He did pass away.
Oh, no.
So don't forget your eye protection
Yeah.
and your eye exams.
Right.
If you have a family history of melanoma, then you, just because of that relationship with that, usually it's a first degree relative, you're at higher risk, even if you never went out in the sun,
Okay.
for developing melanoma. And another thing that's really important is I tell my patients, melanoma can happen in areas where the sun never shines.
Okay.
So I always encourage my patients, have your eye exams, have your dental exams,
Mm-hmm.
have your gynecology visits.
Mm-hmm.
For men, check the scrotum. Check
Mhm.
those areas that never see the sun,
Right.
because I've removed melanoma off a lot of those areas
Okay.
and they don't see the sun.
Right.
So it's very important to do your own little self-checks there. I encourage people about once a month,
Mm-hmm.
because that way you're getting familiar with what your moles look like.
Right.
And if something changes, you'll let somebody know.
Mm-hmm.
And then, so that's family history. Now, if you've never had a skin cancer before, then typically about once a year is a good time to check.
Okay.
If you've had a history of cancer, we tend to see those patients a little bit sooner in follow-up.
Okay.
Studies indicate that usually within that first year of being diagnosed with a skin cancer, you may find another one. Within that first year, it's really high. So we do some regular follow-ups at the beginning, 3 months, 6 months, depending upon the patient and their own ability to see and recognize things. And then after that, we start spreading it out to about once a year
Okay.
for those patients. Catching cancer early, I just love that. Yesterday, I had a patient had a spot on the face that was 1 millimeter.
Okay.
I mean, that's super tiny.
Yeah.
Came back at cancer, but it's gone. I removed it.
Nice.
Cancer-free.
Yeah.
It's great. For the patients that come in who've had something growing for 6 months to a year, and now I'm having to check their liver and their brain and other
Right.
areas because it may have spread. Oh, those ones just make me so sad.
Right.
So the earlier we can catch it, the better.
Well, and I think, if I'm hearing everything correctly, it's really just being preventative, being a good planner, and really just getting into a good routine.
Mm-hmm.
And so just really being able to put everything together before you're leaving the house,
Mhm.
setting apart that time to get your sunscreen on and
Yep.
really having everything organized and ready to go, and really not having it be something that's really so much of a encompassing ordeal as it really is. It's just part of your daily routine and just making that part of your daily habit.
Yep, that's right. Yep, having it right by the back door with your glasses and your hat.
Yeah, absolutely. Thank you so much for all the great information today, and we appreciate you all joining us and look forward to seeing you next time.
Yes, thank you so much for having me. And
Yes.
if anyone ever has questions, we'd love to. That's what we're here for, is to
Yeah.
answer questions and help people find the best way to put their face forward and their skin.
Wonderful. Thank you again, and thank you all.